Hello and welcome everyone. This is the Scientist, and welcome to the next series on the LabZtorm effect. This is the LabZtorm effect v.2, and this series is all about the LabZtorm critique. And I'm going to kick off with this audio podcast around the topic or subject entity around renal point of care testing and collaborations, and this is going to be an overview, kind of highlighting the collaborative effort once again between the ZtormLabostix production and the Renal Patient Support Group, or the RPSG. And this audio podcast will be sort of summarizing an overview of renal point of care testing collaboration between biomedical scientists and community pharmacists. And this relates to a sort of a peer review publication that was published in 2015 in the British Journal of Biomedical Sciences. So here goes. The incidence of chronic kidney disease is increasing, or has been increasing, with the prevalence of different primary healthcare conditions such as hypertension, high blood pressure, and things like cardiovascular disease, and areas are focus and issues in relating to things that cause complications to those who have these primary healthcare conditions. Now, amongst others. Now, what this work highlights is a broader point of care testing. Broader point of care testing, or POCT as the abbreviation is referred to, point of care testing strategies in the community setting are available and have been needed to prevent not just those primary healthcare conditions, but also chronic kidney disease in the community setting, so that it delays the progressive, or delays the progressive effects and loss of kidney function over time, especially those who are suspect or high risk categories. So in this work, the peer review publication highlights that since the publication of a framework, or a documentation related documentation that was linked to the Institute of Biomedical Sciences, or the IBMS, point of care testing, or near patient testing guidance on the involvement of the clinical laboratory. The scientists scientists who would traditionally practice from a laboratory perspective, conducting various assays around various clinical tests and investigations, based on the requests that come from primary healthcare physicians and those who are frontline health professionals in secondary care, for example, can now, or should be now, be able to provide enhanced services, including tests and investigations to to help monitor excuse me, to help monitor certain laboratory parameters. Now, under the current this paper, because it's a collaborative perspective between healthcare scientists, or biomedical scientists and community pharmacists, provide and I would encourage those who are checking out this work, kind of to look at this work in more depth, basically where the in community pharmacy over a decade ago, I think perhaps around the same time or before 2015, in community pharmacy there are 3 tiers of service. There's essential services, advanced services, and enhanced services. Now, under tier 3, or what's referred to as enhanced services in community pharmacy practices, and by the way, community pharmacy or pharmacists practice very differently to laboratory scientists. So just to underline that fact, but in this context, what this paper highlights, or peer review publication highlights, is that from a collaborative perspective, that both health professionals could actually collaborate actually in a community setting, such that based on the requirements that are required in a community, for example, where there are people who might have suspect or high risk for certain health conditions, for example, that these 2 health professionals or groups of professionals come together, so that actually what happens then, on the one side you have health professionals screening and investigating for these particular health complications, and on the other side is where there are health professionals who provide understanding or sort of some of that educational support or perspective, but also in line with that, also provide understanding of certain medicines, for example. And that's not to say that it doesn't happen. It does happen, but not in this way. It doesn't happen from a collaborative perspective, where both types of health professionals are in one place doing that thing at one time. So this paper, in this work, what the author tries to do, or has highlighted, is that under the current that currency, what's referred to as the new pharmacy contract, but it's not new pharmacy. It's not really new pharmacy contract anymore, because the new pharmacy contract kind of have been put into effect over some years now. The community pharmacies are now often equipped with sophisticated record access systems and interfaces to monitor drug interactions in suspect or high risk chronic kidney disease patients. Now, current facilities can be utilized further, allowing pharmacists a more clinical involvement based on community need. Further development of point of care testing in the community, involving collaborations between healthcare scientists, those who might be biomedical scientists or clinical scientists, and community pharmacists, would allow a broader service availability in primary care, and thus might be advantageous in underlying and sort of providing service understanding around chronic kidney disease in the community, especially those who might be a suspect or high risk. And so this peer review publication highlights how both professionals have a kind of a unique, dare I say, a unique selling point, whereby one health professional group has expertise around medicines and medicines issuing and prescribing, etc. And then on the other health professional is are about providing the point of care testing, as well as the some aspects around the screening and quality assurance, and calibrations, and also the sort of doing around those point of care testing kits, for example. There is internal and external quality controls, so that any tests that investigations that are done in community from a point of care testing perspective, that they are close to the calibrations and overall interpretations as what would be done in a hospital laboratory, so that where patient care is concerned, there is synchronicity and it's synonymous. So whether a test or investigation is done in a community setting or done in a secondary healthcare setting, for example, either way, what this paper highlights and what it looked to highlight is how the collaborative efforts would actually be more would allow more integrative practice when coming to reporting aspects of health in accordance to the patient's healthcare records. So this is an overview of this work, and those who are have been checking out the audios and podcasts can check out this in full via the Renal Patient Support Group, the RPSG. It was published in the British Journal of Biomedical Sciences back in 2015, and hopefully this gives an overview. Thank you for listening, and look forward to providing another audio podcast on another important topic in this series, in the second series of the LabZtorm Effect v.2, and this series again is all about the LabZtorm critique. Thank you for listening.